Hi guys, this is John Adamson, the Rehab and Documentation Guru, speaking to you from a rental car today rather than my old jalopy. But anyway, thus the different background. No, I have not bought a new car, and that's not something you do when you have 12 children usually. So this morning, I went to the gym. Been doing it consistently for a little while now and getting back in shape. And as a 51-year-old male, and especially a physical therapist, I'm very mindful of the risk involved with exercise. No longer can I be like I was as a kid or a young man, where I might take on a new type of activity and just kind of go all out, maybe suffer for a day or two with some soreness, but get right into it, no problem. Now I got to worry about things like I've had some problems with chronic lateral epicondylitis caused by me. So I got to be mindful of that. I have, I believe, a little bit of lumbar spinal stenosis. Not diagnosed, but just according to my symptoms. So I got to be mindful of that. I've got a little bit of chondromalacia in my right knee. Got to be mindful of that. So anyway, I've worked training around those to avoid symptom increase. And what I wanted to talk to you today about is proper dosing of exercise for your patients, because let's face it, they probably are either overtrained or undertrained. So a little story first. So when I was an auditor, I was reviewing a claim in which the OT was treating a patient with shoulder dysfunction. And the patient had shoulder pain. And at the beginning of treatment, at the start of care, the patient had like 2 to 3 out of 10 pain. And then I observed in the documentation that this therapist just killed this patient, having the patient do like 6 sets, 20 reps of various shoulder exercises. I'm talking about like 10 different exercises. So this patient could be doing a given exercise regimen, 600 plus repetitions sometimes. And you know what happened? After a few weeks, the therapist discharged the patient. They had more shoulder dysfunction. They had 6 out of 10 pain. And it was quite clear, just casually reviewing the note, they way over exercised this patient. And one of the things that therapists sometimes do is they do overtrain their patients. You got to remember, these patients who are, especially if you're working with elderly, have taken a long time to get in the bad shape they're in. And not only do they have problems with their muscles, but obviously they're going to have problems with their connective tissue, with their joints. And so we do have to be mindful of that. Like, for example, I, as a 51-year-old male, I'm very mindful of the number of sets I do per body part. I usually stick with multi-joint exercises, except for like doing my biceps. But I will maybe do 2 to 3 sets, and that's it. And I finish up. And I do it at an intensity that I know I'm getting a good workout. So we got to be mindful of over exercising, but we do have to be mindful of under exercising. And I've talked about this in a previous video, but I think it's important to come back to, because I still see this a lot. Like when I review charts, even in my new job, one of the things that I see is therapists are not prescribing probably enough intensity. And one of the things that we do that limits our patients most is we give them an assigned repetition number. And so we tell the patient to do 10 reps, do 15 reps, whatever. Now, for some patients, they just need a number. I mean, they're going to tell you, how many should I do? And you give them proper exercise prescription. They go, but how much should I do? And for those patients, I give a number. But I base it on what they're capable of. So what am I building up to? Well, I'm building up to proper intensity prescription. And research has shown repeatedly that, number one, if you go too light, you won't get the same training effects as somebody that's going a little bit heavier. So when I say light, I mean doing like 20, 25 repetitions, and you still got juice at the end of those reps. Modest strength gains can be made with high volume, low resistance training. Some studies have suggested that strength gains can happen around 15 to 20% strength gain, which, for some patients is going to be great. But for a lot of our patients who are very disabled, that's not a very positive strength gain that's going to have positive functional outcomes. So we need to go higher intensity. And one rule of thumb we can use for any patient, regardless of their diagnosis, is the rate of perceived exertion. And I've talked a little bit about this scale in the past. Studies have shown that moderate intensity exercise can demonstrate significant strength gains, significant conditioning response. In fact, I was just looking at a study this morning where they took a group of younger people and they had them exercise at high volume, low resistance, moderate volume, moderate resistance, and then very high intensity, low volume, but high intensity to the point of fatigue resistance. And they found that the moderate resistance group did the best in terms of training effect over time. And I think this is a good principle we can use for our patients. So rather than saying, do this exercise and do it 10 times or do it 20 times or something like that, we should be telling them, I want you to do this exercise, and when you get to a 5 out of 10 rate of perceived exertion, and then of course you explain what that means, I want you to stop. You stop right then and there, and that's all you have to do. And this is something that can be utilized for patients that have muscular strength and or endurance issues, because they can tell how hard their muscle is working, and they can say, okay, my muscle is at about a 5 out of 10 and I'm done. Also cardiopulmonary issues. Patient can work to the point where their respirations, they feel like their heart's beating at about a 5 out of 10 and they can stop right then and there. And that's safe for most any patient you're going to deal with. The only patients you're going to have a hard time with using an RPE scale, of course, is going to be cognitively impaired patients. So with those patients, you're going to have to do more observational skill to determine the rep range. But instead of imposing an artificial rep range on them, give them like an RPE scale and say, I want you to do this until, and then blank. For some of my patients, I've just said, do this until you're just a little bit tired, because they don't understand the RPE scale. And it's not because they're cognitively impaired, they just educationally wise, they have a hard time with that. And it seems to work pretty well, and I've seen some good gains. Now that's not a research-based data. That is purely just, per case. I've seen that, but research does back that up. So exercise your patients to a moderate fatigue level. Generally on the RPE scale, we see that at a 3 to 4 out of 10. So once they get to about a 5, that's time to stop. And you will likely see better response from your patients. Now, what about sets? How many sets should you do? Well, research shows that a geriatric patient, if you do 1 or 2 sets total per body part, that's sufficient. And you think about your patients who have worn out joints, worn out tendons, they're deconditioned. They're not going to want to do 3, 4, 5, 6, 7, whatever sets you're imposing upon them. So have them do a little bit less repetition, and that would be good. And then also I would say this, in home health, we tend to give daily home exercises, and that's a fairly high frequency. You don't necessarily need to work out at that level. Exercise for strengthening can happen 3 times a week very easily, and in some cases 2 times a week might work. Bodybuilders can get away with doing maybe once a week because they're just totally exhausting a body part till the point of they can't even hardly move it with resistance anymore. We don't have that luxury with our patients, and we shouldn't be doing that with our patients. So for them, we're probably looking at a 3 time a week prescription, and that will be sufficient. Anyway, this is John Adamson, the Rehab and Documentation Guru. Not sore from my workout because I'm using proper exercise principles and trying to make sure this 51-year-old body makes it to 101, God willing. Anyway, have a great day, and God bless.